happy to share some of the work that Dr. Bose and I have been doing for the last 3 or 4 years. And what we recently published was the uh, capability of a new radiation modality that we termed flash radiotherapy. What makes flash radiotherapy different than what they currently use is that we deliver the same total doses at a very fast dose rate. So instead of delivering a dose, for example, over the course of minutes, we would deliver this dose over the course of tenths of seconds. And the interesting thing about this is, surprisingly, when we deliver this ultra fast dose rate, we seem to be able to ameliorate the majority, if not all, of the normal tissue complications that plague current radiotherapy protocols and significantly compromise the quality of life of patients. Interesting too is that when we do this, we don't compromise our capability to control the tumor with our radiotherapy. So in one instance, when we give standard radiotherapy, we control the tumor to some extent, but we also induce these unintended side effects. And now with our new flash radiotherapy, we can still control the tumor just as well as we do as standard, but we're also able to minimize the majority, again, if not all, of the normal tissue complications. So one of the big focuses of this study was to show just that the flash radiotherapy was in fact iso-efficient at tumor control compared to standard radiotherapy. Many of the past publications from our group and that of Dr. Bozanon had also used a single pulse or a single dose of radiation. Now, for those of you familiar with what happens in the clinic, single doses are typically not used except in rare cases. And people usually get their cancers treated in a series of doses, which we call fractionated radiotherapy. And so what had not been done up to this point was a study in which we implemented this fractionated dosing paradigm.